Hi, I am Puneet Gupta. I have been asked to talk about my experience at Global Health Clinic about my avian treatment. My story starts 7 years back while I had a spine problem. It was basically a disc protrusion, and I used to have severe pain in my back, and it used to radiate on my right hand. So I was showing these orthopedic surgeons, and one of them gave me a lot of steroids. He did not tell me that they were steroids, and I wasn't told about the side effects of steroids and the things that I have to avoid while taking steroids. And while I took that steroids, I thought I became perfectly all right, and life was normal. And there were things which I would have done that should not have been done, like maybe few drinks, which should ideally be avoided while you're taking steroids. But because I was not told so, I was trying to lead a normal life. So later on, through physiotherapy, my spine pain became okay. But later what happened was, while I used to drive my car, I used to feel a lot of pain in my left leg, especially while pressing the clutch. And our assumption was that maybe it was a sciatica pain. So I did few sessions of physiotherapy, normal physiotherapy, and those physiotherapy sessions were giving very temporary and less relief. So my physiotherapist, she asked me to get a detailed MRI done, and this is how my avian was discovered. Prior to that, I was not aware what is avian also. I was the first case in my family. So while I was discovered with this avian, I was asked to see orthopedic surgeons again. So I met some of the best orthopedic surgeons in Delhi, and the moment you'll go to them, they'll simply tell you, just get it replaced ASAP. They even went to an extent, while I was having grade 1 and grade 3 in my respective hip joints, to stop putting load on my hip joints. They'll collapse, you'll have terrible pain, you should do it ASAP. Before I could meet the doctor, their people from other team would come and they'll start discussing the cost of the hip joint replacement. It was very bugging. So one of the questions I asked one of these orthopedic surgeons was, while he was telling me that he has replaced few hundred hip joints, my question to him was, how many have you saved? And he was red-faced after that. So I could fairly understand that this was the end of road, and there was nothing else except the hip replacement that I'll have to go for at some point of time. I was slightly scared of going in for surgery, so I started looking for alternate treatments. So one alternate treatment that I was told was making a hole in your bone and inserting stem cells, and I was told that is one of the ways in which there are good chances that it could be repaired. But while I spoke to people who got that thing done, the success rate was very poor. People who had grade 1 avian, there it was successful, and that again 50% chances were there. But for grade 3 and above, even it was not proving helpful. And then these corona times started, and I was in terrible pain. Lying down on the bed was pretty difficult. Sitting on a western commode was a big challenge. At my age, while I was 43 that time, 44 years that time, I had to carry a stick, and with the stick also I could barely walk few steps, and that was it. Climbing stairs or going for a steep walk or driving a car were impossible tasks. So during this corona time, surgery was of course ruled out because of the infection which was happening everywhere. So I got to know about this global health clinic through various groups on WhatsApp. So I decided to see Dr. Haraprasad that time. That time he had two clinics. One was in Haldwani and one was in what was the other place? Rudrapur. So me and my wife, we drove down to Rudrapur, and at that time free movement of Rudrapur was restricted. So I requested the doctor, he sent a prescription, and that is how we were allowed. And even Dr. Haraprasad had, I think, 2-3 PP kits over him, and then we discussed with him and he explained how he can regenerate. And to be very, very honest, we only saw 15-20% chances of recovery after discussing it with him, because mostly people whom we talked to and asked about their experience, they were that replacement was the only solution. But one more thing that Dr. Haraprasad told us was that after first few sessions only, I'll be relieved of my pain. So we thought surgery is ruled out now. So let's start off with that at least the pain will go away and I'll be able to buy some more time for the surgery. And that is how I started my treatment. First 5 sessions, yes, the pain went away by I think 16-70%. While I was unable to walk before that, I was able to walk with a limp. Then came second month, and in second month something terrible happened. The bone maybe had started healing or not, I am not very sure, but what had happened was my pain had subsided. So I had gone on a long journey during winters to a religious place, and there I had to walk a long distance. So during that time what happened was the bone below the femur head, there I got a fracture, and my left leg suddenly turned left and I had terrible pain. Immediately I went to Haldwani, I went to Dr. Saab. He told me that this thing has happened. I had a fracture because during the start of second month the bone was still very fragile, and ideally I should not have put a lot of weight on that bone. But now I have this fracture, so my treatment will get slightly more prolonged and I'll have to bear with this pain for some time. So from second and third month onwards, the pain again started subsiding, and by end of 5th-6th month, the pain had gone. But the X-ray to me as a layman was not showing lot of improvement. It was showing some improvement, but not necessarily lot of improvement in the X-ray. But if somebody who had seen me during those painy days would say that I have recovered in a very large extent, to a very large extent. Since I was able to drive after 6 months, I was able to walk, I was able to climb stairs, maybe not like a 30-year-old boy, but yes, but still I was able to lead a normal life. So then the doctor asked me that every 1 month or 2 months you come for a single day session and the healing will continue. So now it has been almost 4 years. I am almost recovered now. Normal things of life I am able to do very comfortably. At times I drive car from Delhi to Dehradun, Mussoorie all by myself on a single go. That's pain free. I'm unable to still run, but walking is not a problem. I can climb 4-5 stories at one go. That's again not a problem. So this makes me understand that the treatment works, because AVN from grade 1 to grade 4 usually does not take more than 1, 2 or 3 years, and my treatment started more than 4 years back, and it's getting better by the day. So that means the treatment works, but the inner healing process in my case was slow, little slow, But I have seen around me while I was getting treatment done, I saw some people who were younger than me in age. They got recovered really fast. It reminds me of a Hindi teacher from Delhi only, and when I saw his X-ray with Dr. Saab for the first time, I was asking Dr. Saab, "Are you sure he'll be able to get recovered?" And after 1.5 years, his hip joints had become absolutely spherical as they were supposed to be. So, anybody who goes for this treatment will have to understand a few things. Number one, Dr. Saab does not have a magical wand. So, he'll give you the treatment, but you'll have to equally work hard with him, like the exercises that he'll tell you. Because what AVN does, it makes your thigh muscles really weak. So, you'll have to regularly exercise, and he'll be able to repair your hip joint, but muscles he'll not be able to do anything. For that, you'll have to really exercise and work hard and make your muscles strong, number one. Number two, which is very, very important, that you have to be patient. Your degradation of your hip joint will start really soon, maybe 2 or 3 months. The progression maybe will start early also. 2 or 3 months the progression will start, that you will be able to see, but the complete recovery might take sometimes maybe 1 year or 2 years, and maybe more also. But that's a slow process which will keep happening, which will not hamper your routine life, number one. And number two, you'll not need to go under the knife, because an artificial thing is an artificial thing, and a normal thing is a normal thing. Normal thing can heal, it can repair. Maybe 5 years, 10 years down the line, there is some treatment which is a magical treatment for bones that will make maybe your bones like that of a 35-year-old boy. But once you get them removed, then that's end of the road. So number one, patience. Number two, exercise. These are two very, very important things which has to follow, and if these things are followed, I think they are able to get fantastic results. One more thing, when I started the treatment, they had small machines, and now I see they have got much better and world-class equipment which they have got, and I'm sure the treatment and the recovery time would be tremendously reduced as compared to my time. So it helped me, and I'm sure it can help other AVN patients also. Thank you.